Hello, my name is Jessica Zamora, and this is my presentation on the population level health education intervention. So, the four health related problem issues that I saw in the community I'm currently living in is substance abuse, insufficient health maintenance, violence and injury, and mental health issues. I would say this is something you see pretty common among a lot of communities, but here especially, there is, I will say, just a little bit of background. I know I'm going to be going more into it in the next slide, but um, there is a lot of a transient population, which does affect the community with the whole mental health and violence, especially the mental health and violence and injury. Um, so Shasta, I'm going to be talking about the city Reading, but it's within the Shasta County, which isn't that big. But Shasta County's population has grown quite significantly within the past few years. Um, Another thing I'd like to point out about this slide is that 18% of Shasta County residents are seniors over 65. This has a lot to do with the insufficient health maintenance. A lot of people from this town don't really maintain their health, and especially the older folks because they've pretty much lived like that their whole life. Um, Non-compliant, non-medical seeking, you know, pretty much that's where they're at there. That's why the insufficient health maintenance is such a problem. And then again, you can even see in 2010 to 2014, 15%, about 26,000 people, that's a lot of people, lacked healthcare insurance. That can be due to the low economic rate. From what I remember, the average household income here in this county is about 40,000 a year, which is pretty low. Shasta County adults have a lower rates of regular exercise than residents statewide, which is kind of odd because within Shasta County there is a lot of outdoor activities, but I mean, I guess if you live here, you don't really take advantage of it. Um, they use a lot of tobacco along with many other drugs. I couldn't really find any statistics on what, percentage of people use meth or heroin, but definitely at work, working in the emergency room, I come into contact with many meth heads, lots of them. And I work in downtown too, so even on my way out, I'm seeing them all. And then this one was pretty interesting, this fact. In 2013 to 14, about 1/8 of Shasta County adults under 70 said their emotions interfered with their performance at work. In the past year, um, yeah, they've experienced a lot of physiological distress. Pretty crazy. So the objectives I chose from Healthy People 2020 are substance abuse, reduce substance abuse to protect the health, safety, and quality of life for all, especially children, access to health services, improve access to comprehensive quality healthcare services. Now, within the city, just to kind of give an example, there is two hospitals, but with that said, there aren't many providers. I know there's, even for me, I'm having a difficult time finding a primary because all of them aren't accepting new patients. But on top of that, there's only like one endocrinologist out here for like your dialysis patients. It's pretty crazy. So, um, definitely they need an improvement. There's not many local clinics or like urgent cares. People really utilize the emergency rooms over here. um, yeah, so it's definitely need different and more. Injury and violence prevention, prevent unintentional injuries or violence and reduce their consequences. Now it has gotten better. I've moved out here recently, but From what I've heard in the past, people, I mean, breaking into cars and getting mugged is a common thing. Now the big thing is rape. There's a lot of women getting raped. So not, again, might be due to the transient people just coming by. Mental health and mental disorders, improve mental health and prevention by ensuring access to appropriate facilities. So that's everywhere. That's a big epidemic, just again, everywhere, not just here. But there's definitely more facilities that they can offer here. I don't know what this is. Okay. So needs assessment, I determined what was needed according to the population I care for at work, because obviously at work I see the people that are in desperate need. Through interviewing some patients and overall seeing a trend in the lack of health maintenance, and opened my eyes to see what the community needs. Through observing and communicating with locals, I have a better understanding the needs of the community. Yeah, just even really driving around too, and just seeing, whether it's homeless people or just whatever it is, I'm able to understand and see that people don't really, there's not many things to do here either, so I'm assuming people, when there's not a lot of things to do in cities, you get more into drugs and stuff like that. So the city just needs more of a community togetherness. So the proceed component, I love this model, but I'll just kind of explain it. The proceed component involves assessing social, epidemiological, behavioral, environmental, educational, and ecological factors that inform the development of an intervention with underlying social cognitive theory assumptions. The proceed component consists of pilot testing and evaluating the implementation of the strategy, its impact on mediators and outcomes of the population. The model, for me, assisted in organizing my thoughts on how I would carry out my interventions. When it comes to performing big plans that affect a population, such as a community, it is important to simplify and apply a strategic model, such as a proceed and proceed model does. This really allowed me to organize my thoughts and be able to really gather information in an organized way so I can carry it out efficiently. So the issues that this community saw, and just kind of how they can go about covering these issues. So individuals of the community that possess the desire for health maintenance, they need to have that. Nobody's going to want to change if they don't want to change. Or I should say nobody will change if they have no desire to change. And then even a community as a whole, there must be some sort of want or desire to change. One person can really affect another person that will just make an overall change in the overall community. Now, a big thing too is information should be easily accessible. It shouldn't be hard to get. It shouldn't be like a secret of how to, provide health promotion within the city. Putting out flyers where it's easily accessible and where lots of people can see it, such as in downtown or in local parks, or, it shouldn't be on the internet, or, I mean, it should, but not just there. It should be everywhere. Obviously, the individuals of the community have to have some type of literacy, but for the most part, I think it's going to be most important to make things simple and easy to read and eye-catching. And again, in order to address current issues, the overall city must be involved. What's pretty cool about the city is there's a big ministry school, one, and there's also a Christian private school that has a really good nursing program, and the students seem very eager. Sometimes I work with them at work, but they seem very eager and focused to help, because they're wanting to help is kind of coming from somewhere different, and then the ministry school, which is Bethel Ministry School, they do a lot of things with the community. They donate a lot to the community. So they even the other day had like a fundraiser for just the homeless population, providing them clothing and stuff. So those are really good for these kind of things. So intervention through public awareness, I was able to grab the attention of locals by providing free classes that focuses on health maintenance. Providing free classes has caught the public eye and allowed them to get excited for promoting their own health maintenance. As they saw, it was easily accessible. So again, going back to that idea that one, it should be easily accessible. Two, it should be simple. They should get excited. So these are some of the things I did for each thing. So violence and injury classes were held on self-protection, whereas self-protective movement available resources for those who may have been abused were provided. So just like local women's like houses, or people who maintain those places, they came and they provided just information just at a booth, and just simple maneuvers were taught. Substance abuse resources were provided for those who are seeking to keep clean and seeking overall better health. Different vendors for local rehab centers were there to hand out pamphlets and more information on accessible programs. Again, people from like a rehab or like a sober living type of housing were there just to provide more information and just things like that. Insufficient health maintenance. Different councils were held for different chronic illnesses. The community sees chronic illnesses such as diabetes, chronic heart failure, and COPD. So just again, information on how to better maintain. And I hope within the near future, more classes can be held for how to manage your chronic illness, and just to provide tips, because some of these people just don't know. They don't know how to care for themselves. And then mental health issues, resources were provided to those whom are seeking help. Shasta Community Health Mental Health was there for any questions to be answered. I work with many of the nurses that work with Shasta Community Mental Health, and they were able to just provide some words and some resources and pamphlets. Here was the overall budget. Everybody pretty much brought, a table and their own pamphlets, so that didn't really cost anything. The whistles and flashlights were bought, so that was $50. Refreshments just for the overall event were provided. The location was free. It was held in a local park, and brochures again were zero because everybody kind of brought their own. So the overall evaluation and outcome measurement, my overall goal was to bring social awareness to the community on health maintenance. Moreover, I wanted the community to know that they can make the change. One person can influence another, and change in one individual will be change for the whole community. I believe that intervention was successful, as the community will be provided accessible free help that will overall change the health of many individuals of the community. With that said, about 80% people signed up to be notified of when more future events will be held. Furthermore, the community was overall interested, and I would say about 80% or 80 to 90% were excited to start their health. And yeah. So results and conclusion. So obviously I was able to understand the precede and proceed model, and utilizing it to just create an overall huge impact on the community. I was also able to bring, again, awareness to health maintenance and health promotion within the community. And what else? Yeah, it was a good turnout. Again, a big thing actually this community sees is violence and injury. So different resources that was my biggest thing actually, because the health maintenance and the mental health and really the substance abuse are really, really big problems. But the violence and injury, I feel like women aren't taught how to defend themselves. So again, with even within just that specific health related problem, I feel like we made a big impact there because we were able to teach local women how to call, what, not even to call for help, but how to protect themselves when they're in a situation, how to fight back, um, and even really bring awareness that there is lots of violence and injury going around. But even with that said, that it has improved, and that the city can be safer. You don't have to be scared to go outside, but also just having those tools, just tools and stuff to protect oneself. So, this is my reference page, and my name is Jessica Zamora, and I hope that you enjoyed my presentation. Thank you.